Hello, this is the Trudy Haynes Show. I'm Trudy Haynes, and welcome because today we're going to be talking about Obamacare. I have two very important guests with me today, Dr. Edward Alexander, who is the owner and the administrator for the Rising Sun Medical Center, and Dr. Kofi Day, who is the pharmacist and owner of the Sankofa Pharmacy, which is nearby, and both of them are here to help you to understand about Obamacare.
Hi, my name is Kofi Day. I'm the owner of Sankofa Pharmacy and the pharmacy manager at Sankofa Pharmacy on Rising Sun. And my position basically on Obamacare is one of optimism. I am glad that, this plan is bringing in 30 million people, 30 million uninsured individuals into the system. And ultimately, this means that we as a nation are taking responsibility for our entire citizenry to ensure that nobody goes without health care in one of the greatest countries in the world. I think not only is it a moral responsibility, but I think it is also an ethical one for healthcare professionals in this country. And that basically is my stance on Obamacare.
Hi, my name is Dr. Edward Alexander. I am the Administrative Director at the Rising Sun Medical Center. I have a very strong interest in the Affordable Care Act, so-called Obamacare, because as an administrator, I am looking at systems of treatment for patients. I believe that the Obamacare or the Affordable Care Act is instrumental in bringing about healthcare systems that will treat all individuals in our country. It is very important that everyone receives good quality health care and that everyone in our country be covered.
Hello, I'm Trudy Haynes. This is the Trudy Haynes Show, and I'm happy to have you with us today because our subject is Obamacare. I have two important guests who are going to talk about it, tell you what it's about, sort of go through it, see how it affects our community, in fact, our country. I have two important guests with me, Dr. Edward Alexander, who is the administrator and director of the Rising Sun Medical Center, where we are today, and with him, a gentleman by the name of Kofi Day. He is the pharmacist and owner of Sankofa Pharmacy, which is nearby, and I want to thank both of you for being with us today. And I think we'll start off with you, Dr. Alexander, just to explain briefly a summary of what is Obamacare. First of all, is it effective as of now?
Well, first of all, I would like to believe that it is, and I hope to give some information that will show that's indeed the case. Obamacare, normally called the Affordable Care Act, the actual name is the Patient Protection and Affordable Care Act.
Oh, okay.
And that's the actual full name of it. Of course, this was President Obama's signature legislation. It was signed, I believe, in March 23rd, 2010 into law.
So we don't have to worry about it anymore. I mean,
well,
it is law.
For a while, there was a bit of a battle.
Uh-huh.
Of course, you had a lot of differences of opinion. I think because of a lot of misunderstanding about what the law was all about, there was there was a lot of battles going on. But finally, in June of 28th of 2012, the Supreme Court deemed it constitutional. So now the Patient Protection and Affordable Care Act is the law of the land.
Okay, it's a long name to remember, but
Yeah, so
what does it mean?
So Obamacare is actually probably the best way to do it, and I think as President Obama said, he likes it being called that way.
You might as well like it because that's what it is now.
The Patient Protection and Affordable Care Act, which we'll oftentimes call it Obamacare, is a law that was passed that is going to change the way in which we deal with health care. It is about as revolutionary in its scope as was Medicaid and Medicare back in the 1960s when that was brought into being. It is designed both to provide protection for a patient, to ensure a certain type of services that were in the past not assured, and also to modify the way insurance companies and others deliver healthcare to individuals and how that healthcare is paid. So this is something which is going to really profoundly change the way that we do healthcare in this country.
Now, first of all, I guess a lot of people say, well, no more Medicaid, no more Medicare, no more Social Security. no more HMOs. Are all those eliminated by Obamacare?
Well, not only they are not eliminated, they're strengthened. Obamacare, or the Affordable Care Act, actually takes into all those forms of health care and strengthens it and it basically codifies it as a part of our healthcare system. Medicare and Medicaid, for instance, have been both given new monies. Monies have been reorganized in terms of how services are going to be performed. Of course, Social Security stands alone, and there are some aspects of the Affordable Care Act which helps and assists Social Security. But no, in fact, all of those systems of healthcare have not only have been really strengthened, and the Affordable Care Act serves as a way of making sure that Medicare and Medicaid and Social Security all survive.
So now, what we have been used to, do we have to eliminate it or change it? For instance, I have what's called an assistant kind of insurance program. I have to pay a co-pay, and I have to have a prescription when I go to some doctors or go to doctors that belong to that company or that is affiliated with that company. Are those kind of things going to change?
No, they will not. In fact, they're going to be, again, as I said, strengthened, and in some cases, their costs will be reduced. The idea of bringing this law into effect is that it's supposed to, over time, actually change the curve as to how healthcare was going. Healthcare was getting more and more expensive over time. What we're finding now with Obamacare, the curve should go down. And in fact, the Congressional Budgetary Office have determined that the law will make healthcare more cost efficient, will not add any new cost to the budget, and over time will result in a reduction in the amount of monies that we pay for healthcare. So, for instance, in Medicare, you have Medicare A, B, C, and D. Actually, you have it all the way up to J. But the main ones are basically Medicare A, B, C, and D. And these systems are, as most people are familiar with those systems. Well, in the Affordable Care Act, those systems are included as part of the Affordable Care Act. But what it does is it says that they're going to, it strengthens them. For instance, let's say, I think Medicare Part D, which is the prescription portion, which the pharmacist will discuss more on. That actually is going to, the amount of monies that are going to be paid by the individual will be reduced.
So you're really advocating this.
Yes,
this
I am.
This is a good thing that's happening.
I'm advocating from the standpoint that it will provide a service, a healthcare service to individuals so that no one will be in this country without health care. Now, there are other aspects
Is that
of health.
inclusive, no one?
Well, in order for the system to work, everyone must pay into the system. That was the biggest contention in terms of the battle over whether or not Obamacare or the Affordable Care Act was constitutional, because it was forcing individuals to buy in something that they did not necessarily want to have. Well, it was determined that by way of the Supreme Court that it is constitutional, which means that every individual that is able to should pay into the system. Now there are examples.
That's scary.
Well, but there are examples. Well, there's a couple of things about it, and that is first, those individuals that can't afford to pay should pay. Now there are individuals who, because of they're in a certain level of the poverty line, they won't be able to pay, and they may be given certain type of credits. The other thing is that this monies that are required to be paid, for lack of a better term, the legislation has no teeth, meaning that if for some reason an individual is not able to pay it, the IRS is not going to be chasing individuals down looking for the money. It has no enforcement arm, so this is designed whereby you're not going to be getting accrual of penalties and debts as a result if you're not able to pay it. The system is designed that if an individual cannot pay it, to work with them to see if there's other means by which the reason that they cannot do it. But there will not be a situation where the IRS will be chasing individuals down for the monies.
That's good to hear. What aspects of Obamacare now will remain intact? For instance, a lot of people may have what I have, an insurance, type of insurance, but we're limited with certain things per year. For instance, I can only get one free eye care, one free dental care, one free something else. So how is Obamacare going to approach those different things that you need, other than just a medical examination?
Well, the Obamacare is designed to, first of all, as I said, to strengthen the aspects of Medicare. You know, there was this big controversy over the $617 billion that was supposedly taken out. This was actually a reduction in the cost that were the monies that were given to hospitals and other providers. There was the so-called donut hole in Medicare Part D.
Yeah, I remember that.
Whereby individuals you find yourself paying a lot more for your pharmaceuticals. That's being reduced. So the system is actually designed to make it better for individuals, and over time we'll begin to see it.
I was just going to say it's over a long run.
Right.
Yeah.
Now, and also there's the cost for health care will be altered by, there's a rule which says that 85% of all health care dollars that are collected by the insurance company must go into health care. The insurance companies are only allowed to use 15% of all monies collected for administrative costs. So if everyone would notice, so some individuals who had private insurance, for instance, they got back a rebate because the insurance companies spent more money over that 15% than they were required to do, and so those monies had to be recouped by the individuals. In other words, the insurance company had to pay individuals, and so people got checks, which showed that the insurance company had used too much of the monies. And that's a great way of limiting costs, because what it says is that 85% of those dollars must go into health care. Now, besides maintaining Medicare, also strengthening Medicaid, because now you're going to be able to put 30 million new individuals into Medicaid. So
what are the restrictions for Medicaid? You have to be a
Well,
certain age or a certain poverty level?
Well, there are certain minor restrictions whereby it usually is relating to your income. For instance, Medicare is a system, of course, that's designed to take care of either our individuals who are at a certain age or individuals who have certain types of disabilities.
Okay.
Whereas Medicaid is designed for people who maybe have certain economic problems, which makes it difficult for them to pay. Now, 30 million new people are going to be signed up for Medicaid. So that's a lot of people who normally would not have had health care is going to be under the health care system. That's going to change dramatically individuals going into emergency rooms, for instance, without health care. That cost of the hospitals paying for individuals who don't have insurance, that cost gets transferred to everyone else. So your insurance premiums go up, and all kinds of other problems happen as a result of individuals not having health care. In this case, because now we have a system which is 100% funded by the federal government, and yet fully paid for in terms of the system, meaning that the deficit will not go up as a result of these individuals coming in. Then now you have systems where individuals will be managed, hospitals will not accrue extra costs, and so it's actually very good for the country, very good for the individuals.
Why do we have so much complaints then from the physicians about this? They didn't like it too much.
Well, if physicians, I mean, we're not necessarily the beneficiaries. Now, I'm going to qualify that by saying the Affordable Care Act or the Patient Protection and Affordable Care Act is looking to emphasize placing monies into those kinds of systems which are much more family-oriented. So the family doctor or the primary care specialist is going to be receiving more dollars. Individuals living in rural areas or in areas where they usually are underserved, money's going to be redirected in those areas. So of course, if you're living in an urban metropolitan region, and monies are now being directed in those areas, or if you're a surgical specialty or other kind of specialty, well, you're not going to be getting as many dollars as the individuals who are going to, relatively speaking, as individuals who are doing primary care medicine. And then there's a very important part where they're now looking at preventive care as codified in the Affordable Care Act. So now they're not only going to be taking care of individuals who have problems, but they're going to be looking to design systems which prevent diseases from happening.
which will bring me back to a very important subject, but I have to bring Dr. Day in here now. Did I say that right? Day, I'm sorry. Coffee is a pharmacist and probably is affected by this Obamacare also, or your business is.
Yes.
In what way?
Well, the first thing that is significant is the fact that, as Dr. Alexander mentioned, there are 30 million more people joining the system. So that means 30 million more people are going to need prescriptions. And, in the grand scheme of things, that is good for business, for pharmacies. That means, I'm going to get more patients that initially I didn't have. One of the biggest ways in which Obamacare directly impacts pharmacy or pharmacists per se is, as Dr. Alexander mentioned, the underlying theme of Obamacare, one of the basic tenets of Obamacare, is preventive medicine. And that is, how do we prevent people from getting, these chronic diseases to begin with so they don't end up in the hospital? It's all about reducing cost in the long run. If we can keep more people from getting sick, either because we assign certain, members of the healthcare team to the patient, as opposed to letting them take care of their own healthcare needs on their own, they're going to have better lives in terms of their healthcare, and that will reduce the burden on the healthcare system. So the role that the pharmacist plays in all of this is there are these new groups or models of health care that Obamacare is basically proposing, and there are groups of health systems where you would have a couple of doctors, a couple of pharmacists, a couple of nurse practitioners, and other healthcare providers all working together as a group, and they're referred to as accountable care organizations, ACOs. So being a pharmacist, if I am
HCOs?
ACOs.
ACOs.
Yes. So being a pharmacist, if I am part of that system, that means that every patient that is covered or is under the care of that ACO, I am a part of the team taking care of them. So let's say Dr. Alexander and I are in the same ACO. Dr. Alexander has a patient, that comes to see him monthly. Dr. Alexander will coordinate his care with me, since I am his pharmacist, to make sure that when he's taking the meds on time, he's taking the right medications, there are no interactions with his medications, they're not experiencing adverse side effects. And as we all know, patient adherence to medication is one of the biggest reasons why some patients don't take their medicines. If you ask anybody that's not taking the medicine the way they're supposed to take it, they might say it's because of the side effects. Side effects is the number one issue. So me being the pharmacist for such and such patient, if I know by looking through the records that, Mr. Smith or Mrs. Smith was supposed to be here on the 1st of every month to pick up so-and-so medicine, but they missed 2 months, I can call Mr. or Mrs. Smith and say, well, why aren't you picking up your medicine? And then she might say to me, well, because I don't like the way it makes me feel. Or I don't like, it's
Or it costs too much.
Or it costs too much. Me having that information, I'm able to talk to Dr. Alexander, because I'm working hand in hand with him, to say, you know what, Dr. Alexander, can we approach this patient's therapy in a different way that will make it more efficient, so that, Mr. or Mrs. Smith, we could either, come up with a new plan for her or him, so that we know that once we come up with a new plan, they're going to be comfortable with it. We're going to know that they're going to be taking their medicines on time, and we know that they're going to be adherent. And if we're able to put all that in place, we know we're doing what we have to do to ensure that, Mr. or Mrs. Smith is having a good quality treatment, you know what I mean? And that way they don't end up in the hospital because they're not taking their medicines.
So, Obamacare, or the health, what's the whole name?
Oh, the Patient Protection and Affordable Care Act.
The Affordable Care Act. We know, or you feel, that this is going to bring about maybe the old system of taking care of someone, where you had a family doctor, and that person, usually a male or a female too, looked after your whole family and kind of saw you on a regular basis and talked about your whole medical history and got to know you.
Yes. In fact, what Kobe had mentioned that these these systems now whereby you have the physician, you have the nurse practitioner, you have the pharmacist,
yeah.
and you have all the ancillary members of the team all working together where information is being shared and therefore coordinating care. The idea is to prevent a crisis from happening where someone has to go to an emergency room or not receiving their medications. These are the kind of things that is part of this system. The Secretary of HHS, I think it's Health and Human Services, is going to be intimately involved as opposed to in this entire system. There are lots of new powers that the Secretary has been given. So this is going to be an active system. There are going to be other kinds of committees set up, both physician, non-physician, patients, whereby this is with the goal of decreasing disease, making sure patients are properly managed, and making sure that the healthcare dollars are being properly used so that fraud and abuse are eliminated, or at least
Supposedly.
diminished. And where you have a system where the monies that are being put into healthcare is being used for healthcare. You know, you also talked about these what they call these markets that are going to be set up in different states. The interesting thing about Obamacare is going to even allow certain states the option of, let's say, one or more states of having insurance companies that are on either side of the border provide insurance together. In other words, this whole notion of one state having insurance companies doing its thing on one side and having another set of insurance companies doing it on the other side, and neither talking to each other and having different premium rates and stuff of that now the Obamacare system allows for there to be interstate.
Crossing the aisle.
Yes,
But
for
they're not
it
doing
to be
it.
interstate insurance interaction, so as to again to help to lower costs and to bring about a better service.
Well, you know that there have been many discussions about government taking over, but from the way you're explaining this is one time when government almost needs to, particularly if you're talking in the area of preventive care.
Well, the government takeover, I mean, we have to admit that Medicaid is being expanded greatly. Medicare is being strengthened, and also costs are being reduced so that, and systems are developed so that people can receive a better care for their dollars. And in that sense, you do have more government involvement. But there is a private sector of medicine that still exists. I think private medicine, my job as the administrative director at Rising Sun Medical Center, and we're primarily a fee-for-service or private organization, is that I work with the clinicians and help set up systems which better allow them to do their work in the private sector. Obamacare does not eliminate the private sector. It just makes sure that individuals who require certain types of basic care are allowed to get that care without a competitive model such as a fee-for-service model interfering with their ability to get that care. So in that sense, that model is eliminated. But the fee-for-service model is also useful to determining what kind of costs, let's say, that Medicare or other systems should be doing. So we still have a very robust private system. But we're also making sure that no individual goes without health care. And that's the most important thing. People are not going without health care, but at the same time, it allows the private system to still have that entrepreneurial and that great spirit of bringing in new innovative technologies. And because a lot of individuals do that because they see a profit in it. And we're a profit-oriented system. And that's a good thing in the sense that it brings forth new technologies which are useful for individuals.
Well, you both have been very enlightening, and I want to thank you for so much information. We should do this again because there are a lot of things that we can do to help people, like I asked, stay healthy as this moves along and supports us rather than taking care of us, really.
I just want to say very quickly, there is a preventive medicine component to the Affordable Care Act also, and that's also very important.
So if anyone listening would like more information for you, Doctor, where would they go.
Well, if any of your listeners have any questions as far as how they're going to be affected by Obamacare, prescription-wise, as far as what pharmacy to use, what they're entitled to, they can call me at the pharmacy, Sankofa Pharmacy, at 215-268-3426, and I'll be more than happy to answer any questions that they have.
And we're going to have you on again, too, because I want to talk about taking up prescriptions.
Okay.
Mom and husband, mother and wife.
And as Administrative Director at the Rising Sun Medical Center, I'm open to any kind of conversations anyone may want to have. Our telephone number here is 215-613-7145.
And do you want to give a website or anything, either one of you?
We are at risingsunmedical.org,
Okay.
and you can visit our website.
And of course, you can see this program again, not only on Bounce, but online. Well, I certainly want to thank our guests for being here today. We'll certainly see them again as Bounce and the Trudy Haynes Show continues, so be sure to tune in. You'll also find us online, Life in Spirit Online. In the meantime, have a happy day.